Have you ever looked at that collection of pill bottles on your counter and just felt overwhelmed? Maybe you have a little weekly organizer with all the days of the week, and filling it feels like a chore you've come to dread. You might have noticed a new sense of dizziness, a fog that's hard to shake, or a fatigue that just wasn't there 6 months ago. And if you've ever told yourself, well, this is just part of getting older, I'm here today to respectfully but firmly challenge that idea. What if I told you that many of those feelings aren't an inevitable part of aging, but could be the result of the single most common and most misunderstood medication mistake that millions of seniors make every single day? The truth is, this mistake is a hidden epidemic. Some researchers, in work highlighted by organizations like the Lown Institute, estimate that what they call medication overload will contribute to the premature deaths of 150,000 older Americans in the next decade. It's already responsible for an astonishing 750 hospitalizations among seniors every single day. But here's the crucial part, the part that nobody seems to talk about. The number one medication mistake isn't about forgetting to take a specific pill. It's not about mixing up your morning and evening doses. Those things are important, of course, but the real mistake is much more subtle and far more dangerous. It's a breakdown in the process, a silent failure to ask the right questions at the right time. And in this video, we're going to give you the tools and the confidence to fix that process starting today. We're going to transform you from a passive patient into the respected and knowledgeable CEO of your own health. Over the next few minutes, we're going to walk through a complete step-by-step guide to taking control of your medications. This isn't just my opinion. This is a strategy built on the research and recommendations of some of the most respected institutions in American medicine, like the National Institute on Aging, Johns Hopkins Medicine, and the American Geriatric Society. We're going to unpack a concept that doctors call the prescribing cascade. It's a domino effect that can trap you in a cycle of over-medication, and you need to know how to spot it. We'll talk about how to become what I call the single source of truth for your own health, a role that is absolutely critical if you see more than one doctor. And most importantly, we will give you the exact words, the specific questions to use with your doctor, not in a confrontational way, but in a way that opens up a true partnership. You'll definitely want to stick around for the part where we discuss the 3 key questions that can safely begin the process of deprescribing or reducing your medications. This is about giving you the power to ensure your medications are helping you live a full life, not holding you back from it. And a quick but important reminder, I am not a doctor, and this video is for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. The goal here is to empower you to have better, more informed conversations with your own qualified healthcare providers who know your unique medical history. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or treatment. All right, let's begin with the absolute foundation of this entire conversation. The biggest mistake, the one that sets the stage for everything else, isn't about a single pill, but about a flawed mindset or a broken process. The number one mistake is the failure to regularly and systematically review and question the necessity of every single medication you take. Many of us, and it's completely understandable, fall into a sort of prescription inertia. A doctor prescribes a pill for a condition 10 years ago, and we just keep taking it year after year without ever asking, is this still the right medication for me at this dose right now? Our bodies change as we age. Our metabolism slows. Our kidney and liver function might change, and a dose that was perfect at age 60 might be too high at age 75. When we don't pause to reevaluate, we open the door to a serious problem that experts call inappropriate polypharmacy. Now, you've probably heard the word polypharmacy before, and it's usually defined as taking 5 or more medications. But that number can be misleading. For some people with complex conditions, 5 or more medications might be absolutely necessary and life-saving. The real danger lies in inappropriate polypharmacy. That's when you're taking 1 or more medications where the potential for harm, the side effects, the risk of falls, the cognitive fog outweighs the potential for benefit. It's the accumulation of medicines that are no longer needed, are at too high a dose, or are simply the wrong choice for an older body. It's easy to see how this happens. We trust our doctors implicitly, and we should. They are highly trained professionals doing their best in a very complicated system. But the system itself has gaps. Appointments are short. Specialists don't always communicate with each other. And so, the most intelligent and safest choice you can make is to shift your role from simply a recipient of care to an active partner in your care. You are the one who lives in your body every single day. You are the expert on how you feel. Acknowledging that and preparing to act on it is the first giant leap toward correcting this foundational mistake. Now that we understand that the real issue is a flawed process, let's look at the most common and sneaky way that process breaks down. This brings us to a critical concept you need to know: recognizing the prescribing cascade. Imagine this scenario, which happens all the time. Let's say a gentleman, we'll call him Bill, starts a new medication for his blood pressure. A few weeks later, he notices his ankles are getting a little swollen. He makes an appointment, and the doctor, seeing the swollen ankles, diagnoses it as fluid retention and prescribes a diuretic or a water pill. But that water pill makes Bill have to get up to use the bathroom several times during the night, which makes him feel tired and a little dizzy in the morning. So he goes back to the doctor, who might then suggest a medication for vertigo or even test him for a neurological condition. Do you see the chain reaction? The prescribing cascade is when a side effect from one drug, in this case the ankle swelling from the blood pressure pill, is misinterpreted as a new medical condition. This leads to another prescription to treat the side effect, which can then cause its own side effects, leading to yet another prescription. It's a domino effect that can quickly bury a person under a pile of unnecessary medications. I remember reading a story about a woman who was eventually taking over a dozen different pills. It all started with a medication for nerve pain that caused constipation. The laxative she was prescribed for that gave her diarrhea. The medication for the diarrhea caused stomach cramps. It went on and on until a geriatrician, a doctor specializing in older adults, finally sat down, looked at the whole picture, and traced the entire mess back to that very first pill. Common side effects that often get mistaken for new problems in seniors include things we so often dismiss as just getting old: dizziness, confusion, falls, constipation, fatigue, and even incontinence. The action step here is to become a detective. The next time you experience a new symptom, especially within a few weeks or months of starting a new medication, your very first question shouldn't be, "What new disease do I have?" It should be, "Could this new symptom be a side effect of one of my current medications?" Bringing this possibility to your doctor's attention can stop the cascade before it even begins. It's a simple shift in perspective that can make all the difference. This leads directly to the single most powerful tool you can have in your health arsenal. The prescribing cascade often happens because no single person has the complete picture. According to a national poll, about 3 in 5 older adults see multiple doctors. You might have a cardiologist for your heart, an endocrinologist for your diabetes, and your primary care physician for everything else. The problem is, these doctors don't always have a seamless way of communicating. The cardiologist may not know what the endocrinologist just prescribed, and neither of them might know about the over-the-counter pain reliever or the herbal supplement you started taking. This is why you, or a trusted caregiver like our caring Carol, must become the single source of truth. This means creating and maintaining a single, comprehensive, and completely up-to-date list of every single thing you take. I don't just mean prescriptions, I mean everything. That includes over-the-counter drugs like aspirin, allergy pills, or acid reducers. It includes all vitamins, minerals, and supplements, whether it's vitamin D, calcium, or something like ginkgo biloba. It even includes things like occasional sleep aids or eye drops. A study found that a staggering 25% of older adults don't tell their doctors about all the over-the-counter drugs and supplements they're taking. This is incredibly dangerous. Something as seemingly harmless as St. John's wort can have serious interactions with antidepressants and blood thinners. Even grapefruit juice can dramatically alter how certain cholesterol and blood pressure medications work. Your job is to create one master list. You can write it down in a notebook, type it up on a computer, or use an app on your phone. For each item, you should list the name of the medication or supplement, the dose you take, how often you take it, and the reason you are taking it. Then, you must commit to bringing this list with you and sharing it with every single doctor at every single visit, including trips to the dentist or the eye doctor. Don't assume they have it in their files. Don't assume one clinic has shared it with another. You are the curator of this vital document. By being that single source of truth, you close the information gap and empower each of your doctors to make the safest possible decisions for you. So now you've embraced your role as an active partner. You understand the prescribing cascade, and you've created your master list. The next step is the one that can feel the most intimidating for many people, for both our worried William and our caring Carol. It's time to prepare for your medication conversation with the doctor. William is afraid to question his doctor. He doesn't want to seem difficult or disrespectful. Carol is afraid of being seen as a pushy family member who is undermining the doctor's authority. These are completely valid fears, and they stem from a good place of respect for the medical profession. But we need to reframe this. This conversation isn't about confrontation. It's about collaboration. You're not challenging the doctor's expertise. You're providing the doctor with crucial new information, your personal goals and experiences. The most effective strategy, according to the National Institute on Aging, is to prepare beforehand. Don't try to wing it in the limited time you have during an appointment. Before your visit, sit down with your master medication list and think about your goals. What's most important to you? Is it reducing your risk of falling? Is it clearing up some mental fog? Is it simply the desire to take fewer pills each day? Write these goals down. Then, write down any specific questions or concerns you have. This is where the framing of your questions makes a huge difference. Instead of saying something that might sound accusatory like, "I think this pill is making me dizzy and I want to stop taking it," try a more collaborative approach. You could say, "I've been feeling more dizzy lately, and I noticed it started around the time I began taking this new medication. Could we talk about whether this might be a side effect and what my options are?" Instead of saying, "I want to get off some of these pills," try opening the door with a partnership-focused question like, "I'd really appreciate it if we could take a moment to review my full medication list today. My goal is to make sure everything I'm taking is still necessary and at the right dose for me now." This language shows respect. presents you as an informed partner and invites the doctor into a problem-solving discussion rather than putting them on the defensive. Writing it all down ensures you won't forget your points when you're feeling rushed or nervous in the exam room. All right, let's just take a quick pause here. We are about halfway through our guide to taking control of your medication safety, and you're doing great. We've already covered some massive ground. We've redefined the #1 medication mistake as a flawed process, not a simple error. We've learned how to spot the dangerous prescribing cascade. We've established the absolute necessity of becoming the single source of truth with a master medication list. And we've just discussed how to frame the conversation with your doctor as a respectful partnership. You are already so much more equipped to protect your health and your quality of life. If you're finding this guide helpful and empowering, I would be so grateful if you took just a single second to tap that like button below this video. It tells YouTube that this is valuable information, and it helps get this message out to more seniors and their families who truly need to hear it. Thank you so much for that. Now, let's get back to it, because the next point gives you the exact script to use in that conversation. So you're in the doctor's office, you have your list, and you've opened the door to a collaborative conversation. Now what? To move from a general discussion to specific action, you need to ask the right questions. This brings us to what I call the 3 key deprescribing questions. Deprescribing is simply the planned and supervised process of reducing or stopping a medication that may no longer be of benefit or may be causing harm. It has to be done carefully, as we know that abruptly stopping certain medications, like some blood pressure drugs or antidepressants, can be very dangerous. These 3 questions, adapted from guidance by organizations like the American Academy of Family Physicians, will help you and your doctor navigate this process safely. The first question to ask about any long-term medication is this: what is the specific goal of this medication for me? It sounds simple, but the answer can be incredibly revealing. You want to hear more than just, "It's for your blood pressure." A better answer would be, "We are using this medication to keep your blood pressure below 130/80 in order to reduce your long-term risk of a stroke." This clarity helps you understand the why behind the pill. If the doctor says a medication is to prevent something, it's fair to ask, how effective is it at preventing that? And what is my personal risk without it? This helps you weigh the benefit against any side effects you might be feeling. The second key question is, what are the potential risks of me continuing to take this medication versus the potential risks of us carefully trying to stop it? This is the heart of the risk-benefit analysis. It shows your doctor that you're thinking critically. For example, a sleeping pill might help you fall asleep faster, but the risk of continuing it might be a significant increase in your risk of a fall and a hip fracture, or next-day grogginess that affects your thinking. The risk of stopping it might be a few nights of poor sleep. Seeing it laid out like that makes the best decision much clearer. Your doctor can help you understand both sides of that equation based on your specific health profile. Finally, if you and your doctor agree that reducing a medication is a good idea, the third question is essential. If we decide to stop or reduce this medication, what is our specific plan for tapering off it safely? This is non-negotiable. You should never stop a long-term medication cold turkey without a doctor's guidance. The plan should include how you will reduce the dose, over what period of time, what withdrawal symptoms or other issues you should watch for, and when you should follow up with the doctor. Having this clear, step-by-step plan ensures the process is done with maximum safety and turns a vague idea into a concrete, actionable medical decision. Now, your doctor is a crucial part of your healthcare team, but there's another expert who you probably see even more often, and who's often an underutilized resource. That is your pharmacist. Too many people think of their pharmacist as just the person who counts the pills and puts them in a bottle. But a good pharmacist is a highly trained doctor of pharmacy, a true medication expert who can be a vital part of your safety net. The key here is to use one single pharmacy for all of your prescriptions. When you spread your prescriptions across multiple pharmacies, maybe one at the grocery store, one mail order, one near the specialist's office, you are fragmenting your information all over again. No single pharmacist can see the whole picture, but when you consistently use one pharmacy, your pharmacist can become a powerful ally. Their computer system will flag potential drug interactions that a busy doctor might miss, especially when prescriptions are coming from different specialists. I know someone whose mother was prescribed a new antibiotic by a specialist. When she went to her usual local pharmacy to fill it, the pharmacist immediately flagged that the new antibiotic had a serious, known interaction with her long-term heart medication. The pharmacist called the specialist, explained the situation, and recommended a different, safer antibiotic. That pharmacist's check-in may very well have prevented a life-threatening cardiac event. Your pharmacist is also one of the most accessible healthcare professionals you have. You don't need an appointment to ask them a quick question. You can ask them about the best time of day to take a certain medicine, whether it should be taken with or without food, or what to do if you miss a dose. So make a point to introduce yourself to your pharmacist. Let them know you want them to be an active part of your medication safety team. Using a single, trusted pharmacy is one of the simplest and most effective safety strategies you can implement. Our final point is about taking your role as an empowered health CEO to the next level. After you've built your team with your doctor and pharmacist, you can become an even more informed participant by familiarizing yourself with some key resources. This is about trust, but verify. This isn't about playing Dr. Google or trying to outsmart your physician. It's about learning the language and understanding the landscape so you can ask smarter, more specific questions. One of the most important tools in this area is something called the American Geriatric Society Beers Criteria, often just called the Beers List. This sounds a bit strange, but it's not about beverages. It's a list developed and regularly updated by a panel of experts in geriatric care that identifies medications that are potentially inappropriate for older adults. These are drugs where the evidence shows that the risks often outweigh the benefits for people over 65, or where safer alternatives are available. Now, it is crucial to understand that just because a medication is on the Beers list doesn't automatically mean it's wrong for you. There are always individual circumstances, but familiarizing yourself with the list can be incredibly eye-opening. You can find it by searching online for AGS Beers criteria for older adults. If you see one of your medications on that list, it doesn't mean you should panic or stop taking it. Instead, it becomes a perfect, evidence-based reason to start a conversation. You can go to your doctor and say, "I was doing some reading on the Health and Aging website, and I saw that this medication I'm on is on the AGS Beers criteria list. Could you help me understand why it's the right choice for my specific situation? And if there might be any safer alternatives we could consider." This is the pinnacle of being an empowered patient. You are not making demands. You are referencing a credible expert source and using it to open a respectful dialogue. You are bringing valuable information to the table and partnering with your doctor to make the absolute best decision for your health and longevity. So let's bring it all home. Today, we've dismantled the myth that medication problems are just about forgetting a pill and replaced it with a powerful new understanding. The real challenge and the real opportunity lies in fixing the process. You've learned that your first win is recognizing that the biggest mistake is a failure to regularly review your medications, leading to inappropriate polypharmacy. Your second win is knowing how to spot the prescribing cascade, so a simple side effect doesn't spiral into a host of new prescriptions. Your third victory is committing to becoming the single source of truth by creating and maintaining that master list of everything you take. Your fourth win is knowing how to prepare for and begin the medication conversation with your doctor as a partner, not a passive patient. Your fifth win is having those three specific, powerful deprescribing questions ready to go. Your sixth victory is recognizing your pharmacist as a key safety expert on your team. And your final win is knowing how to use trusted resources like the Beers criteria to become an even more informed and effective advocate for your own well-being. You have the power to change the narrative from "this is just part of getting older" to "this is part of me taking charge of my health." You are the expert on your own body, and armed with this knowledge, you are now also an expert in navigating the system to ensure your medications serve you, helping you to live the vibrant, clear-headed, and independent life you deserve. Now, I would love to hear from you. Which of these points was the biggest aha moment for you? Was it the idea of the prescribing cascade, the master list, or perhaps the specific questions to ask your doctor? Please share your thoughts in the comments below. Your story and your insights could be the very thing that helps someone else in this community. And if you enjoyed this deep dive and want more content designed to empower you on your health journey, please be sure to hit subscribe and ring that little notification bell so you don't miss our future videos. Thank you so much for spending this time with me today. Be well, stay empowered, and I'll see you in the next video.